Greetings from Basataragam Indo-American Cancer Hospital. I am Dr. Rakesh Sharma, Chief Uro-Oncologist working here. This is the month of September. It is called as a Prostate Cancer Awareness Month. So the intention here is to make the public aware of the disease called as prostate cancer and to the patient and families who are already suffering from the prostate cancer to support them. So what is prostate cancer? Prostate cancer is a cancer which develops in a male reproductive system called as prostate, which is present below the bladder, only present in male. It is the size of a walnut. So all men beyond 55-60 years will have symptoms related to prostate enlargement. But in a few of them, the development of cancer may happen. So the symptoms of urine has to be differentiated between the prostate cancer and a benign enlargement of prostate, which happens as an aging process. So we need to do evaluation for these patients. There are two basic evaluations. One is a simple rectal examination where a urologist will check the patient who has urinary symptoms like frequency of urine, getting multiple times in the night for passing urine, reduced flow of urine, straining to pass urine, occasional blood in the urine, recurrent urinary tract infections. So these are the signs of prostate enlargement and even in cancer. So all men beyond 60-65 should get themselves evaluated and try to rule out a prostate cancer. So a simple rectal examination to feel the hardness in the prostate, whether it's cancerous or it's a age-related enlargement, and then a simple blood test called as a serum PSA, which is available in most of the laboratory. So I would recommend everybody, all men beyond 60-65 years with urinary symptoms to get themselves evaluated. Now, prostate cancer, why needs so much of attention? Because it is the second most common cancer in men, and again it is the second most common cause of death because of cancer in men after lung cancer. That's why we need to be very much aware and educated about this cancer. Second thing, it's quite a treatable cancer if you diagnose them at the early stage, that is the stage 1, 2. Stage 4 is the problematic area. So problem in India as of now is majority of the patients are still presenting in the later stages, like stage 3 and stage 4. So by this education video, we want to tell our people to get themselves aware and get diagnosed as early as possible by getting themselves evaluated. So who are the high-risk patients? There are known indications for the development of prostate cancer, but like any other cancer, smoking, alcoholism, these can be the risk factors for developing prostate cancer. Again, obesity, some dietary factors are the reasons. Hereditary factor also plays in the development of prostate cancer, especially if your father, your grandfather, your brother had prostate cancer, they have a chance of developing prostate cancer because they might be harboring genes which are responsible for developing prostate cancer. The difference is these patients who are hereditary prostate cancer, they develop the cancer at a little early age, that is more commonly between 45 to 60 years. So anybody who has a family history, get yourself starting to test around 45 years. So there are some genes called as the BRCA1, BRCA2, the ATM genes. These are the more common genes which are responsible for prostate cancer. There are another 25-30 genes which are less common. So another family history, if your family members have suffered from breast cancer, ovarian cancers, they also are having more risk to develop prostate cancer. Regarding the investigation, I told you these are the basic investigation, the PSA test, which will help you get the information. Later, once the patient has some suspicion for prostate cancer, they undergo MRI, they undergo prostate biopsy, and later on, based on the treatment, they'll undergo, and based on the stage, they'll undergo the treatment. Regarding treatment, the stage 1, we can treat this patient without doing any major surgery or radiation therapy. Stage 2, we can do a robotic surgery, which is available in our center. Also, we can do a radical radiation therapy. And in stage 3, again, we have the option of surgery and radiation. But But in stage 4, since it is already spread to the other parts of the body, there is no role of any robotic surgery or radical radiation. Here these patients are kept on something called as the hormone therapy, the chemotherapies, some tablets, and we try to extend the life of the patient by these therapy. So all in all, I want to get my audience, the public, aware of the prostate cancer, because this is the month of prostate cancer, this is September month. So please, whoever is your family member, your parents, your grandparents who have urinary symptoms, kindly get them evaluated. These basic tests are available everywhere in most of the diagnostic center. You can get yourself evaluated by urologist. If anybody wants to come to Basavadarkam, they are most welcome to get themselves evaluated. Thank you very much for listening and viewing this informative video. Thank you.